I mean, there's all sorts of ways of matching it and making it. But however you cut it and whatever way you do it, it's going to need a lot of people. So actually having some understanding of the type of workforce you need to do the job, how many and when, and what roles they occupy, and how flexible you can make them is highly important, I think. I would say that leadership is a function at all levels in the social care sector. In strategic leadership terms, I suppose there are national political strategic leadership issues, and the obvious one is the funding of social care. It's a critically important thing that social care has the right level of funding to enable people to be cared for by whatever model or means that we choose. Simply starving it to see what happens is not a good solution. There are leadership challenges in local areas, local authorities, because less and less of what is being provided by them. Invariably it's contracted out to somebody else and maybe 2 steps away from them where it's actually being delivered. And the leadership issue for me at the front line is the work between the worker and the service user. And my view is the only valid measure of quality of any of it is the quality of what happens between that person and the person they are supporting in whatever type or shape that is. And those people understanding the nature of their role as a leader with a small L in contributing to the social care effort is probably, I think, the single most important. The fragmentation of services from being largely public in the 60s and 70s to largely externalised into private companies is the biggest of those. That's now being added to by an increasing number of single employer situations where a person is buying their own care, managing their own employees to deliver their own package of care. Now it's quite clear that if a lot of people do that, you'll have a massive, complicated monitoring and quality assurance challenge. How do you know what's being done for who, and how good is it? And the risk of scandalous failure is increased. This workforce has to be valued in the same way as other parts of the health and social care sector. We wouldn't ever consider at the moment deregistering nurses and saying, well, why would we register them? Why would they be regulated? And one of the things that is a critical part of this is that people doing this job need to be valued in the sense that they're licensed to practice and they have a personal accountability for what they're doing, whoever they work for, in whatever role.